My name is Lexi, and I'm going to walk you through how to add and edit patients in your PreViser Clinical Suite. Now that your office is registered and enrolled, click on your shortcut or bookmark to access the Clinical Suite login. If you do not have a shortcut, refer to the related video on how to set one up. To create a patient, select New Patient. Enter in the patient information, first name, last name, gender, and date of birth. When entering in the patient details, be sure you are using full names, especially if the patient's insurance carrier participates in an additional benefit program. You will also notice a section for any patient notes. For example, some clinical staff choose to note unlocked additional benefits once the assessment is complete. Next, select Insurer information. Select the insurer of the patient using the drop-down menu. It is very important to select the correct insurance company so the patient receives any additional benefits provided by their dental plan. If the insurance company is not listed or the patient does not have dental insurance, select None or Other, save, and move ahead. If the insurer is listed, enter in the information as indicated by the asterisks. Once all necessary information is entered, click Save Patient. If all information was entered correctly, you will be notified with a pop-up message saying, "Success, patient saved." If you get an "Oops" message, confirm the spelling of the patient name and any other details you input. If you are still having issues validating the patient, contact the number on the screen for assistance. If you need to edit an existing patient, select the patient name and click Edit Patient. Here you can update demographic information and insurer information like group numbers. You can also inactivate a patient from your clinical suite if the patient moves to a different provider or if you accidentally create a duplicate patient record. To do so, select No where it says Is the patient active and click Save. Keep in mind, once a patient is in your clinical suite, they will be there until you manually inactivate them. The final way to upload patients is through a CSV file. If you have the enterprise version, check out the related video in the According section. Hi, it's Lexi again. PreViser is a great tool to bring a patient and clinician together to improve the patient's oral health. One way to do so is by getting the patient involved in the assessment. The PreViser Health Questionnaire contains questions the patient can fill out themselves before being assessed by the clinician. The main purpose is to save time on the clinician input and allow patients to be more hands-on with their own oral health. While logged into the PreViser Clinical Suite, select the patient from the patient list, which will take you to the patient's details page. Select Health Questionnaire in the bottom right corner of your screen. You can send the questionnaire to the patient by email. Input their email and hit Send. A patient can also access the health questionnaire by quick response, also known as a QR code. Have the patient scan the QR code with a phone or tablet by opening the camera on the device and select the rear-facing camera. Hold your device so that the QR code appears in the viewfinder of the camera app. Your device will recognize the QR code and show a notification. Tap the notification, which will pull up the health questionnaire for that specific patient. The patient will then be prompted to fill out the questionnaire. Once the patient hits Submit, this is the message that will appear. To access the most recent health questionnaire information in the clinical suite, select the desired assessment, load last values, and complete the remainder of the assessment. By engaging the patient in the questionnaire, it highlights the partnership to improve their oral health. Not only that, but the health questionnaire saves time for the clinician. Instead of asking patients all the questions chairside, patients can get a head start before their appointment, such as at home, in their car, or the waiting room. The health questionnaire engages patients and their oral health and ultimately saves time in the operatory. Hi again, I'm Lexi, and I'm going to show you the best part of PreViser, how to complete an assessment. I want to show you how quick and easy it is to complete a risk assessment. The first assessment can take anywhere from 3 to 5 minutes, but every assessment after that can be completed in less than a minute. Keep in mind that an assessment can be completed on a computer or tablet, whatever is accessible to your clinicians. To start, open the patient details page. Decide which assessment you will be completing, either the perio, caries, oral cancer, or comprehensive assessment. Although other risk assessments exist, unique to PreViser is a complete overview of the patient's oral health. Our recommendation is to complete the comprehensive assessment on all patients, so the patient has a clear understanding of where their oral health is today and how to improve it going forward. Also, clinicians may use the Caries Risk Assessment CDT code 601, 602, or 603 to track the production of the risk assessment, since no CDT code currently exists for the perio assessment. For today's example, we are going to complete a comprehensive assessment. Select Comprehensive. Input the hygienist or dental assistant's name who will complete the assessment in the Prepared By box, and choose the responsible clinician. If your dental provider does not appear in the Responsible Clinician drop-down menu, please refer to the video in our Registering and Updating Account section. Now fill out the required information to complete the assessment. Note that all questions are pre-populated for a healthy patient. Only change what is necessary and applicable to the patient. Once a patient has a completed risk assessment, you can preload the patient data for any future assessments. You can check that out in our Clinical Suite topic video. Once you get to the end of the risk assessment, you will see a treatment options and laser therapy box. By selecting treatment options, you and the patient will see evidence-based treatment suggestions corresponding with the patient's scores that will appear on the final report. If laser therapy is an available treatment option in your office, you can check the box that will then generate a message about laser technology in the treatment recommendations section of the report. Once you have answered all report questions, click Submit. This is where the clinician will see the patient report and a check benefits button if the patient's insurance participates in an additional benefit program. Watch our video in the Clinical Suite section to learn more about this process. Not all insurance companies offer the check benefits button or additional benefits. If you have questions regarding a specific insurance company, reach out to that company directly to learn more. The PreViser Comprehensive Report takes oral health improvement to the next level. The easy-to-read report emphasizes the value of treatment recommended by the dentist while reinforcing the benefits of good home care. This evidence-based report is a key component to improving the patient's oral health, which is why the report should be shared with the patient. You can learn more about this in our report details video. Hello, it's Lexi again. You may be wondering why there are so many buttons at the top of the PreViser risk assessment form. PreViser has lots of functionality to help your staff explain oral health to your patients. Let's say you are in the middle of an assessment but need to step away. Click the Save for Later button to save the assessment. Otherwise, the system times out after 10 minutes and the information you entered will be lost. Another button is Model This Patient. This is a great tool to use when showing patients how to improve their oral health. You can show a patient their existing report and demonstrate how lifestyle changes can impact their score. For example, by selecting the patient no longer smokes cigarettes, you can click Model This Patient. PreViser will then generate a hypothetical report that will show the patient how their oral cancer scores improve if they stop smoking. The Model This Patient button is a good training area for new clinicians to become familiar with the tool without submitting an actual assessment. It is important not to confuse Model This Patient with Submit, because Model This Patient does not send the assessment scores to the insurance company. The final and most important button is the Submit button. If you have filled out the assessment to its entirety, click Submit. This will generate a report for the patient, and if the patient has an insurance company that provides risk-based benefits, the scores will also be sent to the insurer. You can check the time and date stamp here to ensure the assessment was submitted to the insurance company on file. By clicking Submit, you are indicating the patient information is true, accurate, and current. Now you know what the different assessment buttons mean. Hi, it's Lexi. I'm going to talk about the individual scores within the PreViser report. The comprehensive assessment gives a quantitative score for the 3 major oral diseases: tooth decay, gum disease, and oral cancer. The first score is the tooth decay risk score. This score describes the likelihood that without appropriate home and professional care, the health of your teeth may worsen, resulting in tooth decay or breakdown of existing restorations. The restorative needs score assesses the amount of active tooth decay that is present and if any restorations are failing. The gum disease risk score focuses on the patient's gum health. This score shows the likelihood that the patient will get periodontal disease in the future. The next score your patient will see is the gum disease score. This quantifies the current disease status for the patient. Because the scores can change, this alerts the clinician the minute periodontal changes happen and gives the clinician the opportunity to address them at their earliest stages. The Gum Health Stability Score is a great feature that measures exactly as the title states, the stability of gum health. Finally, the Oral Cancer Risk Score demonstrates to the patient what factors and behaviors they have that increase the chances of getting oral cancers. Notice all scores have an explanation below to help the patient understand the score. After the scores, the patient will see tips on how to maintain or improve their oral health regarding the 3 diseases. Next, the report continues to dive deeper into why alcohol and tobacco use can be dangerous to the patient's oral and overall health. The What Can I Do section includes important factors to consider after the dental visit. Finally, the patient will find the Additional Resources section, which includes helpful links related to oral cancer. Keep in mind, the report is an educational tool that can be shared with the patient by email or a hard copy printout. Check out our Sharing Reports with Patients video to learn more. Once an assessment is completed, it will be in the clinical suite for future reference. This makes future assessments easier to complete, as previous data will auto-populate by using the Load Last Values button. Future assessments can then be completed in less than a minute. Hello, it's Lexi again. PreViser works with many different dental insurance companies to support their oral wellness programs. It is worth taking the time to check patient eligibility, as additional benefits can be significant for those whose plans do participate in oral wellness programs. To access the additional benefits, verify the patient has coverage through one of the listed companies under the Insurance Company drop-down menu. The correct information for the member must be entered and verified. Next, the clinician will complete the risk assessment and select Submit. At that time, PreViser sends the patient's risk assessment scores to the insurer on file. You can verify the time and date it was sent in this area. Depending upon the benefits program, the patient may unlock additional benefits. Some dental benefit companies utilize the Check Benefits button. This feature notifies a clinician of the patient's additional benefits. Keep in mind, not all patients' assessments will show a Check Benefits button. This can occur for a few reasons. The patient's plan does not offer additional benefits, or the dental benefits company uses a different process. If the Check Benefits button does not appear, confirm with the patient's coverage to understand their benefit program. We encourage you to use your existing method to check patient eligibility with the insurance carrier. Now that you have submitted your risk assessment and verified your patient's dental benefits details, let's check to see if they unlocked any additional benefits. To do so, select Check Benefits. Scroll down to the Enhanced Benefits section to evaluate what additional benefits the patient may have. This will also have a link explaining what the details of the additional benefits are. If you choose, You can use the Copy button to copy the additional benefits into your practice management system or within PreViser. You can also reference the patient's dental benefits here. Enhanced benefits information is only available on the same calendar day that the risk assessment is completed. Keep in mind, not all dental plans offer additional benefits, and if they do, they can vary from state to state. Contact the specific dental benefits company should you have any questions on their additional benefits. Keep in mind, these additional benefits can be significant and make a positive impact on the patient's oral health. As I mentioned earlier, you can note additional benefits in PreViser on the Patient's Details page under Patient Notes. Paste your previously copied pop-up message and select Save. Now you know how PreViser partners with different dental benefits companies and understand the Check Benefits feature. Hello, it is Lexi again. Now that you created the report, I'm going to teach you how to share the report and why it is so important. In today's society, we are used to scores in our everyday lives. Whether it is the score of a sporting event, your credit score, or a grade in school, the PreViser assessment generates a quantitative report that gives an evidence-based score to show where the patient's oral health is today and how to improve it in the future. Not only is the report a benefit to the patient, but also to the clinician. The report provides support and credibility to the oral health messages that clinicians have always delivered. Reports are also a great reminder to improve oral health home care. Studies show patients who have a PreViser risk assessment and go over the report have an increase in compliance of recommended treatment plans. Just a few of these added benefits show the value of PreViser, but all attribute to improving the oral health of your patients over time. As mentioned before, reports are a great tool to be shared with patients. They help patients track their oral health progress over time. To share the report, select Share and click Print or Email. If you select Email, enter in the patient email and click OK. If the patient already has an email on file, this will appear here, but can be updated if the patient wants it sent to a different email account. If the patient does not want the report emailed, be sure to print a copy for them to take home. The report is a great tool for a clinician to use in the dental office when talking with the patient. This can be shown on a clinician's computer, tablet, or the patient's mobile device. No matter the device you use, the PreViser report is a great tool for the patient to find your oral health care tips and recommended treatment plan that can help improve their oral health. Hello, I'm Lexi. Let's walk through the steps of how to import an assessment from a referral office. If your patient had a PreViser risk assessment at another office, the patient must bring in a previous PreViser assessment report or get in contact with that other office and ask for the clinical access code at the bottom of the patient's PreViser report. This feature allows you to import clinical data. However, the demographic and insurer information still needs to be entered prior to importing the previous assessment information to ensure the patient is successfully verified. This feature will bring in all previous clinical data for that patient. Now your patient is created, select Import Assessment, type in or copy and paste the clinical access code, and select Import. Now you have successfully imported your patient's previous assessments. Welcome back, it's Lexi again. Remember how I mentioned future assessments can be done in less than a minute? If you have a patient who already had a PreViser assessment, log into PreViser. Find your patient using the search bar on the Patient Browse list and enter the patient first or last name. Open the patient details and click on the intended assessment. Select Load Last Values and verify all assessments have a checkmark that you intend to pull from. This will pull up the patient's latest risk assessment done by your dental office. Now update any changes to the patient's oral health and submit. This makes future assessments easy to complete and extremely efficient.